Hi guys, in this video I'm going to talk about the 4 main reasons your ears feel clogged. Coming up. Hi, I'm Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions. And on this channel I cover a bunch of hearing related information to help make you a better informed consumer. So if you're into that, consider hitting the subscribe button. We've all experienced it, clogged ears. But what causes your ears to feel clogged? I'm going to cover these 4 main reasons right now. Reason number 1 is earwax. Now, as the name suggests, earwax is a natural waxy substance that's secreted by the skin glands inside of your ear canal. Now, earwax is important because it coats and lubricates the ear canal and protects against things like fungus and bacteria. Earwax typically migrates out of your ear on its own, but there are some cases where either ear canal anatomy or using Q-tips can push that earwax down in further inside your ear and it doesn't actually come out. This is what we call impacted earwax. The professional removal of earwax will involve 3 options. The first one is by curette, or having it picked out of your ear. The second option is suction, to suck it out of your ear. And the third option is irrigation, which is using water to flush it out of your ear. If earwax is too dry, it can become very hard. And when it's really hard, it's really difficult to get out of your ear. If this is the case, you'll probably have to use some kind of an earwax softener like Dysfunction. I don't recommend trying to pull earwax out on your own. That is how you can injure your ear, and then you'll have way more problems than some built-up earwax. Now, the second cause is Eustachian tube dysfunction. Now, the Eustachian tube is a tube that connects from your middle ear space to your throat. The dysfunction occurs when that tube is either swollen or won't open to allow passage of air when you swallow or yawn. Now, if this tube gets clogged, it can create either a positive pressure inside your middle ear space or more oftenly a negative pressure inside your middle ear space. What this will do is this will retract your eardrum to the point where it actually causes pain. The sensation that you would usually feel is the need to pop your ears. Now, Eustachian tube dysfunction usually coincides with either having a cold or having a sinus infection, and it could also lead to the buildup of fluid inside your middle ear space. When you have a retracted eardrum or fluid inside of your middle ear, both of these things restrict the movement of sound from your outer ear through to your inner ear, which can create that muffled sensation. Now, there are circumstances where when you have this Eustachian tube dysfunction and a virus or some bacteria gets into the fluid of your middle ear space, it can result in a middle ear infection. Middle ear infections typically give you the sensation of pain because of the inflammation and the infected fluid that's behind the eardrum. If you do have this sensation, you should seek medical attention immediately. Reason number 3 is an outer ear infection, sometimes known as swimmer's ear. Now, this happens when your ear canal becomes inflamed and generally produces some kind of pus or fluid that leaks from your ear. When this happens, when this fluid that's leaking is thicker and infected, then it typically means that you need to seek medical care to have some kind of antibiotics or treatment on your ear canal to get it to go away. And just remember, if you just got done swimming, you may just have some water inside your ear, so make sure that you give it a chance to dry out to make sure that that's not the problem before you seek medical care. Okay, on to reason number 4, and probably the most serious of the causes of sounds feeling muffled or your ears feeling clogged, and that is sudden sensorineural hearing loss. Some of the symptoms of sudden hearing loss are the occurrence of a hearing loss without a real reason. Typically happens in one ear, but can happen in both ears, and it's not really accompanied by pain. It just happens. You either wake up and you can't hear out of one of your ears, or you're driving in your car and all of a sudden the hearing goes out in one of your ears. Other symptoms that can come along with this is the sensation of dizziness or oral fullness or fullness in your ear, and tinnitus, that ringing and buzzing that you get. Now, the typical causes of a sudden hearing loss are either a virus that's destroying your cochlea, which is your inner ear hearing organ, or a tumor, a rapidly growing tumor on your auditory nerve. Either way, both of these situations are extremely serious, and it needs to be diagnosed right away if treatment is going to be successful for you. A lot of people mistakenly assume that it's earwax causing this, and that isn't always the case. Treatment for this condition often can include the use of an injection of a steroid through your eardrum, oral steroids, and an MRI to ensure that it is or isn't a tumor. There you go, guys. Those are the 4 reasons why your ears might feel clogged. Sometimes it'll be something as simple as just getting some earwax taken out of your ears, and other times you can save your hearing by treating it sooner rather than later. That's it for today's video. If you have any comments, leave them in the comment section below. If you like the information in this video, feel free to give it a thumbs up, and don't be afraid to hit the subscribe button. I'll see you next time.